Hello, everyone. Today I'm here with my Aunt Michelle. She is a registered nurse in Connecticut. And I actually have a couple of questions for you, but I do want to discuss something real quick. This is a pandemic like nothing I've ever seen before in my lifetime, and most of us haven't seen anything like this before in our lifetime. And I know it's a stressful moment for individuals staying at home, but it's more stressful for healthcare workers. So, are there any tips or suggestions that you can give us as a community to kind of help you and guide you guys?
So honestly, yes, it is. It's huge. It's been referred to as greater than the Spanish flu of 1918.
Mhm.
So long before any of our lifetimes. Uh, the best advice we can give for the community, honestly, is that stay home and don't consider it stuck at home. You're safe at home. Stay home, hyper vigilant hand hygiene. And I do wish they had called it physical distancing as opposed to social distancing. As you and I are talking right now, we can all be social with technology today, but it's that physical space apart from each other and just closing our doors. That's the best way to even keep our healthcare workers safe so that they can go to work and be less exposed than, now they're getting exposed inside and outside the facilities.
All right. So I actually do want to give a shout out. I have a coworker of mine. His name is Patrick Tardy. If you're watching, hey Patrick. So he has come up with these masks, and
Right.
he's got some ties. You can either tie it. I've actually just looped it and then looped the ears on. So, what is some good mask care?
So good mask care obviously is, don't touch the inside that's going to your face with dirty hands or down onto objects that have not been sanitized. And when you remove your mask, make sure that you wash your hands immediately, because if there are any contagions on the outside of the mask, you now have it on your hands.
Okay. And how about I know you had mentioned to me about pipe cleaners. What should
Right. So any sort of a thin wire that you can put to go across the bridge of the nose, maybe to about mid cheekbone, that'll mold over your nose into your face, blocks a gap where somebody's particles could possibly get in.
Oh, perfect. Okay.
Um, and masks, I'm glad you brought it up, are probably the second most important thing compared to the hand hygiene, whereas gloves for general community members are not so important and are being misused so terribly, which is really sad because our healthcare workers need them desperately. Those gloves really don't accomplish anything but make it worse when you're touching everything with them. The best thing you can do is just bare hands and remember, hand sanitize and hand wash really, really frequently.
Oh, well, that's good to know because, I've been lacking on gloves lately. I went through my first box, but I mean, I go to a showing and I throw them away, and then I go to the next showing and throw them away. Some people are just reusing gloves and, do one hand and only do everything with that one hand so that they're limiting the gloves. But that's really good to know that I don't have to wear gloves all the time. So
Mhm.
I actually do have a cloth that I've been using, and what I do is I throw it in a plastic bag and then I launder it before, anything else, and then I'm hand sanitizing afterwards. So
Right.
is that a good idea or is that not a
So
good
it's creating a barrier. There's no real bad ideas except for the gloves, and then you touch your face and your phone and your keys, and those are bad ideas. As far as using any other type of barrier, it's okay. It's not a bad idea. It's just maybe unnecessary. The biggest thing: sanitize that doorknob, then touch it with your clean hands, and then sanitize your hands afterwards anyway. Those are probably the best things. It's people say vigilant hand washing, and I'm saying hyper vigilant hand hygiene. Yeah.
Okay,
That's the
perfect.
best thing we can do, and where we can, obviously, virtual communication as opposed to physical communication. I mean, I just canceled Easter with my grandkids. That kills, but it's better than me being responsible for killing them. I mean,
Exactly.
it sounds so harsh, but that's the reality we live in right now.
It's unfortunate. It's true. This pandemic is real.
Yep.
So take good care of yourself. Do not bring this home to your friends and family. Do what you can to protect yourself and protect your family, just like my aunt just told us. So I don't know what else to say. It's important. Wash those hands.
Stay in, stay well.
I like that one. Well, have a good day, and thank you so much for joining me today.